Good afternoon, Peter Goertz. I'm a psychiatrist. Are people sometimes diagnosed with a mental illness when they do not have one? In my opinion, yes. So as psychiatrists, we want to do our best to detect mental illness, but we also want to do our best to detect the absence of mental illness. And what led me to think about this was a patient I saw recently, and she was brought in by her family, and she was actually felt by the emergency room doctor to at least potentially require psychiatric hospitalization. But then when I talked with her, it seemed like she was in distress, but not psychiatrically ill. And it seemed like the distress was a workable distress so that she did not need psychiatric hospitalization. And I spoke with the family at some length. I had spoken with the patient. And overall, it seemed okay for her to go back home, and most likely preferable for the patient to go back home than go to a psychiatric hospital. So that brought up this issue because it definitely can happen that people who do not have a mental illness are diagnosed with one. Another example that happened years ago was a lady who was felt to be psychotic and actually admitted to a psychiatric hospital. And she had, in hindsight, it seemed to me, had maybe a spiritual or intuitive experience, but then behaved in a way that could be seen potentially as bizarre. But when I spoke with her about that, she did not seem psychotic, and I did not feel she needed to be in a psychiatric hospital. Another patient who had been hallucinating, but it turns out only when she was falling asleep or waking up. She had been diagnosed as psychotic and was in a psychiatric hospital. But again, it did not seem like she had psychosis, but what we call hypnagogic and hypnopompic hallucinations. We want to get collateral information, so information from family, maybe friends, and that can help us to tease out potentially if someone has a psychiatric illness or not. But we want to be careful because family and friends can also have their agenda. Let's say family wants to get the patient's money or belongings. They may at times act maliciously and want the patient to be psychiatrically hospitalized so they can take advantage, for instance, financially of a patient. So we have to be careful even with the collateral information. The DSM in this respect, I think, is helpful because in pretty much any diagnosis that I recall, there is a statement saying that in order to be diagnosed via the DSM, you need to see some impairment in functioning. So it could be patients not eating, not sleeping, having difficulty with their family, not able to work, not able to attend school. So there has to be some impairment in functioning in order to have a diagnosis. Let's say if someone is hearing voices but doing well professionally, let's say a doctor, enjoying their family and not suffering but hearing voices, I would not diagnose that person with a mental illness. And what we're talking about really is what gets to the root of being a patient. The word patient has a Latin root and it means suffering. So if there's no suffering, there may be no mental illness. People can have unusual beliefs that may tempt us to diagnose them with mental illness, but what the majority believes is not always true. For example, people used to believe that the earth was flat, and Galileo Galilei had a lot of problems because he stated that the earth was round and ran into a lot of opposition with that and suffered quite a bit. So what I said about mental illnesses also goes for physical illnesses. We want to, if at all possible, be able to detect physical illnesses, but we also want to be able to detect the absence of physical illnesses. And detecting the absence of mental illness or detecting the absence of physical illness can sometimes be especially tricky. And that ties into first doing no harm. So first we want to do no harm. So we do not want to diagnose people with illnesses, mental or physical, unless we're pretty convinced that they have a mental illness. And that way, hopefully, we can avoid having the patient undergo unnecessary diagnostic procedures or unnecessary treatments that may have potential adverse effects. Thank you.